Well, thank you very much, Madam PS, for giving us this opportunity to speak to us on matters of cervical cancer, noting that this is that month where we are celebrating and calling upon more women to go and get tested. Remember that the country has made steps in making sure that this matter is addressed. But why speak too much yet? We have the PS for Public Health and Professional Standards, Madam Mary Muthoni, whom we want to get straight into it and ask her a number of questions with regards to this cervical cancer and if she's calling upon women to come out. And to our first question, what is the government's overarching vision in addressing cancer in Kenya?
The government and the ministry, through the Ministry of Health, envisions a nation free from the preventable burden of cancer. Because, and this is as outlined in the National Cancer Control Strategy of 2023 to 2027. Again, this vision aligns with the Kenya's Constitution, which guarantees the right to health to every individual. If you look at Article 43 of our Constitution, gives a right to every person. And again, it also aligns with the bottom-up economic transformation agenda. You have seen us come up with bills that later on become acts. And these acts are actually aligned. It's like the base of what we want to happen in the health sector in Kenya. Therefore, Kenya is emphasizing cancer prevention, primary health care, and digitization of cancer services.
Well, thank you, Madam, for that. And why are we giving cervical cancer a priority? And what has the progress been so far in the country? Are more women being tested? Are they going to the hospital? Or what is it?
So cervical cancer is the leading cause of cancer mortality in Kenya today, with 5,845 cases, new cases yearly, and 3,591 deaths annually. So these are very, very high numbers, and this is just a cervical cancer. And to address this, the Ministry of Health has been at the front line by first training the healthcare workers in cervical cancer screening and treatment of the same that is integrated with breast cancer. Again, we have equipped facilities in 47 counties that is to treat cancer, precancerous lesions. We have also developed and distributed information, education, and communication. I know very well that even our community health promoters, they have information, basic information about cancer. They can tell people. They are advocating for people to go to the health facility to be tested and screened. There is equally the introduction of HPV vaccination. Remember, this is a vaccination that is targeting girls aged between 10 and 14 years through facility-based, the schools and community outreach programs. So these are some of the things that we have been able to do, because if we have the human resource to train and treat, if we also have people to talk about it for promotion purposes, and we equally have vaccination that is going to reach to younger girls at a very tender age, then we will be able to prevent cancer as much as possible in this country.
There is a WHO global strategy that has been adopted in trying to eliminate cervical cancer in the world. When we come here to Kenya trying to domesticate it, what strategies have we adopted as Kenya?
WHO has is committed to achieving 2030 targets, and the WHO global strategy, which includes vaccination of 90% of girls aged between 10 to 15 years. Then we also have the screening, 70% of screening of women aged between 25 to 49 years. And I want to remind the women that this month of January is cervical cancer awareness and screening month. that we should all come out and become screened. Then there is ensuring the treatment of cervical cancer, which is at 90% target. And the progress, which has been very steady, with the national cervical cancer screening rates increasing from 11% in 2018 and 2019 to 38.5% in 2022-2023. So we can say really we are on the right track, and we want to increase of the same. If it is the issue of screening, let's go to 100% screening of women to cervical cancer.
HPV vaccination is a key component in addressing this whole matter of cancer. How is the government probably driving this in making sure that people go out?
The national HPV vaccination coverage in 2023-2024 was at 28%, that is dose 1, and 24%, that is dose 2, with variations across counties, different counties, because of dynamism again. We have issues of culture maybe, and maybe availability. However, the ministry looks into improving these rates by ensuring that we are conducting community engagement, outreach, and sensitization of the masses. I've already said that our community health promoters, they equally have the basic information of what to talk to the masses as they move from one household to another household, and is injected in our curriculum again. The training of healthcare providers to enhance vaccination efforts, which is very, very critical, and equally to strengthen the school-based vaccination programs, because this is going to be a game changer for our young girls who are between 10 and 15 years.
There is the question of financing. We know that the bottom-up agenda and the Kenya Kwanza government has been very keen with regards to putting more finances into health. How are we looking at financing the burden that is cancer, and more cervical cancer, noting that this month we are celebrating it?
In health financing in the fight against cancer, I am confident to report that the cancer screening is included in our primary healthcare fund, which is a new thing and is working, that women can go for screening at the health facility using the primary healthcare fund. Equally, the social health insurance fund covers oncology packages. And this is a game changer really, that we can do screening, prevention and treatment at the same time. And it is important to note that women should continue registering to the social health authority to ensure they access these services that are being offered at our health facilities. I am confident to note that using this primary healthcare fund, the social health insurance fund, we will be able to go many, many miles. And equally, the chronic illness fund that will come into play, so that should you go on excess in the social health insurance fund, then we will be able to plow into the chronic illness financing or fund, so that somebody could be treated.
Digitization is one of the aspects that the president put into law as part of the 4 laws that were promoting a preventive more than a curative approach to health. How has digitization helped in bringing down the levels of those affected by cervical cancer in the country?
Cancer prevention and treatment has been integrated in our ECHIS, which is Electronic Community Health Information System. And this helps us or strengthens our data collection, monitoring and evaluation. And it also ensures that there is good tracking of HPV vaccination, the screening rates, treatment outcomes, which eventually improves service delivery and resource allocation. With this data, we are able to also make decisions in terms of policy. We are able to make decisions in terms of resources that we require, whether it is coming from the donor world or coming from the exchequer.
There are about 107,000 community health promoters in the country. That is our whole army that is reaching so many households, not just here in Nairobi, but also in those parts of rural Kenya. How do you bring in their expertise, or how are they trained to make sure that they get information so that the government knows where they're investing and in which cancer?
Community health promoters have been trained, they have been kitted, and they are paid a stipend. Therefore, and these are people who come from the communities, they are able to effectively deliver culturally, because they are people who speak your language. They are people who know where you come from. They are able to track each and every step that you take. They are able to also convince you, or even promote issues to do with screening, so that more and more people are screened at the community level. More and more young girls are vaccinated against cancer. Therefore, and are also able to mobilize at the community level. Therefore, with supporting people living with cancer is very easy at the community level, to end stigmatization equally. Speaking to the communities during barazas, why they need to support these kind of people. It is important to note that these are agents to improve health promotion at the community level, knowledge and education on cancer and cervical cancer particularly. Again, they are also able to support the referral patients. Cancer wears you out as it advances, and supporting these cancer patients, maybe speaking to them on the nutrition they need to take at this particular time, how to take care of themselves while they are away from a health facility. Scaling up HPV vaccination at schools. I know the government has been very keen about this at school level, school-going children aged 10 and 15 years, having all of them vaccinated before they clock the age of 15, 16 years, which is very, very critical. And of course, screening is the way to go. At any given time, you may have that reversed if it has not advanced to other stages. Therefore, if we are able to get screened every other year for cervical cancer, then you could be treated and reverse some of the conditions.
Public participation is one key aspect that is enshrined in the Constitution of Kenya. How is the government using the public to speak on issues of cervical cancer and creating awareness? I know that awareness is partly a problem spoken, is a problem partly solved. How do you advance this agenda to make sure that more and more Kenyans are adopting to what you're speaking to?
One of the calls that we are making today, from the many other calls that we have done through our institutes, through the ministry, we are calling on the media to be part and parcel of this, to be our allies, so that they can share this clarion call to the members of the public that get screened, and especially for cervical cancer this month, when we have cervical cancer awareness and screening.
Well, thank you very much. That was PS Mary Muthoni, PS for Public Health and Professional Standards, speaking on the Cervical Cancer Month and why you should go get screened. Remember, it is happening across the country. It is happening everywhere. And remember that cancer burden is huge. So even as she says that it has been incorporated in the bottom-up economic agenda plan, remember that health is personal. The more you take care of your health, the more people will take you seriously. Thank you very much.